that was really the case. But it's obviously promising. People have said before in these briefings, it would be very surprising if there was no immunity after an infection. But at the moment, I think the science is still not precise about how much immunity you get and how long it lasts. But nevertheless, results such as the one you mentioned are encouraging.
Thanks very much, Sam. Victoria MacDonald from Channel 4.
Thank you, Secretary of State. Can I just say that I'm not quite sure that Sam's question was answered. There was a report in the HSJ that previously a test would be counted only once the sample had been processed, but that testing has now changed and that it's being counted once it's been posted out. Is that the case? And then, Secretary of State, I wanted to ask you specifically, the ONS figures today show that you are twice as likely to die from COVID-19 if you live in a deprived part of the country. What is your reaction to that, and what policy implications does that have for you?
Yes, I'll ask John to answer the point from the HSJ, but it's not something I recognise. The point on the deprivation and the point that in more deprived parts of the country there appears to be greater impact. This is something that we are worried about and looking at, and we're looking at it in the context of all of the different ways in which this disease seems to have a different impact on different groups. So right from the start, we've known that it has a much more serious impact on older people. It appears to have a bigger impact on men. It appears to have a bigger impact on people from black and minority ethnic backgrounds. It appears that people who are obese are more seriously affected by the disease. And there's also this new evidence from the Office for National Statistics of the correlation with deprivation. So we are looking at all of these things and trying to understand the impact of the virus as much as we possibly can as and when we get new evidence. John?
Yeah, so there's been no change to the way tests are counted. As we've developed new ways of delivering tests, we've taken advice from officials as to how they should be counted. So the tests that are within the control of the programme, which is the great majority, are counted when the tests are undertaken in our laboratories. But for any test which goes outside the control of the programme, they're counted when they leave the programme. So that's the tests that are mailed out to people at home and the tests that go out in the satellite. So that's the way they are counted, have always been counted, and the way we were advised to count them by officials.
That's all set out on gov.uk. Sam Lister from The Express.
Thank you, Health Secretary. I'm concerned party. Can you reassure over 70s who are fit and healthy that they will be treated exactly the same as the rest of the population when lockdown measures are eased? And also, it's been made clear today that this is not over, but now we are past the peak. People will obviously rightly be hopeful that they can start making plans to see family and friends again, perhaps even have a holiday, or meet up together and have a holiday together. Is late summer a realistic timescale for this?
Well, Sam, the last question is very tempting to speculate at. But unfortunately, we just don't know. It's still too early to say, and I'm really sorry to have to give that answer, but it is. The 5 tests we've set out are there partly to try to give everybody a sense of when we'll be able to make those next decisions that I know people are yearning for. But we will only lift the lockdown measures when it's safe to do so. This is why test, track and trace is so important, because it will help us to do that. It isn't necessary to have that in place, but it helps enormously. But it is, as of today, too soon, and hence the message remains to stay at home because that protects the NHS and saves lives. And on your first point about the over over 70s. Maybe Steve, I can ask you to ask this, but there are, we were always clear from the start. There's a very specific group who we've been in contact with, who we're asking to shield, which is ensure that they have as little contact as possible with other people for their own health reasons. And after that, the question is a degree, a gradation of the advice. Steve.
Yes, so of course we know, as you know, that that the over 70s can be absolutely fit and healthy, and that it's not the case that everybody over 70 has a chronic health condition or an underlying disease. As the Secretary of State said, we very specifically asked a group of individuals, some of whom are in that age bracket, but not everybody, to shield and to do everything they could to stay at home, because we knew that their underlying conditions put them more at risk of serious complications from COVID-19. So that's the group that is being shielded. Of course, everybody is complying with social distancing measures at the moment and being asked to stay at home, whatever age you are. So in the generality at the moment, everybody is in that same boat of complying with those measures. I think as we look forward, and as I said at the very start, the government moves to another combination of measures, including track and trace, that will help us keep the infection under control going forward. I think it's a perfectly reasonable question to say how would that work in sort of age groups and age bands, and although we do know that complications and unfortunately deaths are more common in the elderly, even without complications, I think that's for consideration, and that's work I think that we will need to do as we move forward. But I think your point is very well made.
Thanks very much, Sam. Alan Preston from the Belfast Telegraph.
Good afternoon. I just have two quick questions for the Health Secretary. In Northern Ireland, the impact of coronavirus has not been quite as severe compared to the rest of the UK due to factors like a lower population density. Do you think there's any merit in eventually easing restrictions here at a different pace to other parts of the UK? And my second question, as this virus does not respect borders, do you think it would be better for Stormont to work on an all-Ireland basis in fighting the pandemic rather than following the UK lead?
Well, thank you. The thing is that across the UK, the level, you're right, that the level of the virus has been different in different parts of the country. I mean, we saw that in the chart earlier, that in London, the level's been much higher, in other parts of the country, lower. But what's interesting is that the shape of the curve, the rise and then the fall in the virus that's just started, has been basically the same throughout the country. And so that means that moving together, I think, was the right approach at the start. And I can see the case that could be made. And of course, the decisions that are devolved, we respect the devolution settlement. But ultimately, if you look at the shape of the curve, getting R down and getting the level of new cases right down, that's happened the UK together. Of course, the relationship with the Republic is important as well. And we have good relations in terms of both at political level, but also at medical level in conversations with the Republic, with the decisions that they take. But we have very intensive discussions within the UK about the timing of changes within the country. Thanks very much. Steve Ford from the Nursing Times.
Good afternoon. A Nursing Times survey has indicated almost all nursing staff are feeling more stressed and anxious than usual, and a third described the state of their mental health as bad during the COVID-19 crisis, for reasons including PPE shortages. So my question is, what are you going to do in the long term to protect the mental health of nurses and other staff on top of the helplines that have already been announced, as we already have a well-documented nurse shortage, and I hope you'd agree that we can't afford to lose any more in the coming months? And secondly, what's your message for Black and minority ethnic staff who feel they may have been put at greater risk given the emerging evidence from the mortality data?
Thank you very much, Steve. I think that the way that nurses across the NHS have risen to this challenge has been admirable. The bravery and the flexibility that nurses have shown right across the NHS. I think that's something that the whole country recognises it, and I recognise it as Health Secretary. I think that certainly the measures that we have put in place to help people with the stress and more serious mental ill health as a result of work, those measures are important, and I'm very glad that they're in place. I've been trying to get them in place for some time, and we managed to put them in place very quickly as the crisis began. But the other thing, it's undoubtedly true when you talk to nurses on the front line, that increasing the number of nurses so that there are more to do the work that's needed is a really important part of the plan. And as you know, we committed in the election to 50,000 more nurses by the end of the Parliament. We remain committed to that. In fact, we've seen more nurses come into the NHS over the autumn, and then also as a result, direct result of the appeal for nurses who'd left the profession to come back. So we have got more nurses back into the NHS, and I want to support and cherish every single nurse who works in the NHS because of the important work that they do. And so I'm sure that'll be a big conversation as we restore the NHS, and thank everybody for the work that they've done during the difficulties of coronavirus. Steve, I don't know if you want to add.
Yeah, no, I think your point again is a very good point. And of course, it's not just nurses, as you pointed out yourself. It's all staff. There's been a tremendous effort by staff across the NHS. They have been working incredibly hard, sometimes in different areas from where they usually work, and of course that brings its own stresses. And I know, talking to the chief execs and the medical directors, chief executives and medical directors of many of our hospital trusts across the country, that as we begin to now stand up some of the services that we have had to stand down to manage this surge in coronavirus patients, those leaders locally are thinking very hard about how they support staff, because they absolutely recognise that they have gone through a very challenging and at times very stressful number of weeks, and that support is required both in the short term and over a longer period of time to ensure, as we move back towards a normal, won't be completely back to normal while we still have COVID, but back towards normal, that staff have the support they need. So I think the comments you've made are very much reflected in the comments I hear from our leaders across the health system.
Maybe you could answer Steve's second question as well.
The second question, just remind me, the second question was, Steve?
Black and minority.
Right, yes.
Oh,
what's your message for black and minority ethnic staff?
And John might want to answer some of this as well. So I think the message for black and minority staff is that we absolutely recognise, as Secretary of State said earlier, that this virus is disproportionately affecting staff, and I absolutely know the concern and the worry amongst our colleagues in those groups. And in fact, I've been talking to them over the last few weeks, as I'm sure Secretary of State and others have. So there are things that we can do in terms of supporting staff and helping them through the concerns that they have. I think there's another piece of work that John will be able to talk about, which is to understand why it is, and again, Secretary of State touched on this a little bit earlier, why it is that the virus seems to be disproportionately affecting members of staff and the population as a whole from particular ethnic groups. So that work is ongoing in Public Health England, and I think maybe John will be able to say a little bit, because of course that will also inform what we need to do and the approach we need to take going forward. John?
Thank you. Yes, so as we know, the statistics do show increased rates in some people with some ethnic backgrounds. The effects are relatively small, and they do need to be looked at, although very important. But we do need to also look at some of the other aspects of the virus. So, for example, the virus is present in different rates in different parts of the country, and we know that that different parts of the country have very different groups of people from different backgrounds. So we need to look at all of these figures together to try and understand what's really going on. And so there is cause for concern, definitely, and we are talking to NHS England about any advice that should be given based on the data. But there is also an important bit of statistical work to be done to try and understand what the real underlying risks are. And I think it's sometimes it can be wrong to take these statistics at face value. We also know that unfortunately, some different ethnic groups have different levels of underlying health conditions. So, for example, people from an Asian background do have more diabetes. And so we're trying to look at to what extent those factors might be at play as well. But it's a very important issue, one that a number of people are looking at, Public Health England, but also a number of university groups are also studying this. And we're feeding the results back to NHS England so that staff can get the right advice, exactly as you say.
But I think it's important for us to emphasise that we don't need to wait for that data. That data and analysis is important, but we don't need to wait for that to provide additional support. And in fact, when Simon Stevens, Chief Executive of the NHS, wrote out to our healthcare organisations, to hospitals this week, he made a specific point of ensuring that local healthcare leaders do pay particular attention to supporting and do whatever they feel is necessary locally to support our BAME colleagues. And I know from even today talking to some of those local leaders that they are absolutely doing that and providing that support.
Thanks very much, Steve. Does that answer your questions?
Yes, thank you.
Thanks very much indeed, everybody. That concludes this daily coronavirus briefing. Thank you.
This is a message from the government. Coronavirus is a national emergency, life-threatening for people of all ages everywhere in the UK. To help save lives, stay home. Only go outside for food, health reasons or work, but only if you cannot work from home. Stay home. Anyone can get it and anyone can spread it. Stay home. Protect the NHS frontline staff working to save lives.